Hello, everyone. I'm Evelyn Williams. I'm the Policy Director at the chapter. Welcome to those of you who are joining us for the first time, and welcome to those of you who have been with us before. We are now in 2022. Amazing. We started this journey in 2020, and the idea was to engage members in identifying legislative issues that they would like to see addressed by the legislature specifically, but also by the governor's office. And over these past 2.25 years, it has been an evolution, and it's truly amazing what has happened. We started with 5 subcommittees: critical issues, professionalism, populations, social justice, specialty practice. Those 5 committees were created in June 2020. And by September of that year, we had staffed all of those committees with members from the AGR committee, which is Advocacy and Government Relations Committee of the Board of Directors. And so from 2020 to 2021, we started our first advocacy efforts by identifying some legislative priorities, whereby we created position papers. And then when the legislative session started in January 2021, I'm just trying to get the years here, we began to monitor what was happening in the legislature, as well as identifying the governor's priorities and meeting with legislators, specifically hosting our first Capital Action Day, which occurred in February of 2021, where we had a chance to present our priorities to legislators and their staff, not only asking them to support our priorities, but also asking if they needed any assistance from us in terms of helping them with their agenda, those items that we would consider pertinent to the profession. What could we do to assist them in helping that legislation to finally be passed? So of the priorities that we had presented at that time, one was passed, which is the less is more legislation. And that legislation was part of a 2-year movement around creating and passing legislation to address criminal justice reform. And this particular legislation was enacted in order to address the inequities of people who are on parole, who are subsequently put back in prison due to minor violations, such as showing up for a meeting late, or not coming to a meeting at all because they have a job, or not getting their job fast enough. And so we are actually seeing the outcome of that legislation this year. March 1st of this year will be the enactment, the full enactment of the legislation. And it is projected that over 20,000 people who have been imprisoned for minor violations will finally be released and be able to return to their families and to be able to become productive citizens in the state. Another piece of legislation that we were somewhat supporting, we had issues and we were still analyzing, was the Health Act. And that legislation did not pass last year, but it has come back again this year. And we have learned that it has passed the Health Committee in the Assembly. And we shall see what occurs going forward with that. So those were the major ones. Also, we somewhat not strong advocacy, but we did support the marijuana legislation indirectly. And primarily the reason why we supported that was that in that legislation, it is stated that 30% of the revenues that the state will receive from people growing and selling marijuana in the state, 30% of those monies will go back to communities that have been harmed by the war on drugs legislation coming out of the federal government. And that is extremely significant because in looking at some of the other states that preceded New York State in terms of this type of legislation, it was reported, for instance, that one state in 6 months after enactment of the legislation, they had $500 million in revenue from the sale of marijuana. So you can imagine what 30% of revenue could mean for communities that have been negatively impacted by the war on drugs. So then we're in 2021, and we had, been advocating, meeting with legislators, and the budget was passed. And then some of the other bills that did not require budget dollars at that time, they were passed in May and early June. But as you know, there was something else that was very significant last year, and that was the resignation of Governor Cuomo and the entrance of Governor Hochul. And so there we were just saying, well, wow, wonder what is going to happen with this. Simultaneously, in June of last year, we examined the structure that we had created in 2020, which was a model that Mark, who's chairperson of the AGR committee, Sam and I created. And we said, all right, we need a structure for members to be able to have direct interaction with staff around formulating legislative priorities. We had no idea whether this was going to work or not. But over the year, it was just really quite interesting because it wasn't just incumbent upon the staff to identify legislation that members might be interested in. We were asking members, we said, well, what do you think? What do you think we ought to be looking at? And some people actually did do that. And they said, oh, we've heard about this legislation, or they themselves, because they're interested in a particular topic, they themselves did research and presented various pieces of potential legislation to us. And so we saw in analyzing what had occurred in 2020 into the end of the legislative session of 2021, we said the structure is working. We needed to make some minor modifications, and we also had to be clear about what constituted work in the subcommittees and commitments, members' commitments, because we see the legislation that we support as extremely important, and that we need to be very consistent in working towards our priorities, hopefully being addressed in the legislature and in the governor's office. So we wanted to make sure that members who said they were interested in being a member of the committee, actually that was a commitment on their part, and it worked. And so we definitely felt that the structure ought to be retained. As I said, we did some minor tweaking, and we continued with the utilization of the 5 subcommittees. So going into September through December of last year was the time for the subcommittees to talk about what are some of the issues that they feel are germane to their particular committee's theme, such as social justice or critical issues or professionalism. And to give you an example, which is still in the works right now under professionalism, and I think sometimes it goes under specialty practice, it depends, but there has been a strong interest in talking about social workers' caps, particularly in organizations where, some social workers may find themselves with caseloads that are just too high. You can't perform quality care if you have too many people that you have to see within one day. And so that has been something that is been in the queue since 2020. And what has happened is that there is a piece of legislation that has been proposed, and we're watching it, for another profession, not social workers, whereby they are requesting caps. And so what we have decided is this might be a breakthrough moment for us, because one of the things you can do is once a legislation has been passed in an area, it establishes a precedent. And so therefore then, if this does pass and we're watching it, that would mean that next year we can come with our proposal around caps for social workers. It also will give us time. And again, some of the members on that committee are actually still doing the research and looking at other models in terms of, are there caps currently being utilized in other states, which there are, such as Florida, and how can we either use those models or take aspects of those models and then come up with a proposal. And that's what we will need to do. We'll actually have to not only request caps, but then offer models that might work for us in this state. So that's an example of, what the committees have done. We've had other committees who actually have presented legislation. For instance, we have a position paper for the maternity care legislation, which is indicating that women who are informed that they will need to have a cesarean birth, or maybe the women choose to have a cesarean birth, that they receive the full information around what does that entail and what are the potential outcomes of having a cesarean birth. This comes from instances whereby women who may have limited education, women from low-income communities or communities of color, that sometimes are not given adequate information to make the appropriate choice. So this legislation was presented to us by one of our subcommittee members, and that is one of our legislative priorities this year. So as I indicated, there was this, we could say, a shock in the fact that we had the change of governors right after the New York State budget was passed. And so for us, we were saying, well, this is interesting. What will the legislative tone be in 2022? What will the governor's priorities be? How will there be a shift in what is considered to be of importance and where that emphasis is placed in the legislature? Along with that, last year, we learned that the 2021 legislative session, that's comprised of legislators, was considered the most progressive legislative session in the history of the New York State legislature. And that is attributed to a number of young people. When I say young people, people 20s, 30s, maybe hitting early 40s at the max, came in. And so therefore, that new energy, that expansive consciousness around, being in a different generation, influenced the conversations that occurred in the legislature. And we're seeing that we're seeing how those progressive young people who came in, how they have had a very important impact on how this year is looking. Simultaneously, Governor Hochul, we were waiting to see what she would say and how she would approach issues that are important to us, or just on general issues. And when she came out with her State of the State message in January, I think it was January 6th, it was quite interesting because she started talking about things that, for instance, we had members talking to us about loan forgiveness, and we were exploring what could we do perhaps with that. And then she came out and started talking about loan forgiveness, and we were saying, wow, the door is open to talk about loan forgiveness. But she also talked about a number of other things. And she definitely had strong emphasis on mental health practitioners. And we said, yes. So it gave us an opportunity to think about what are the types of policy issues that we could begin to examine in relationship to the type of legislation that is being proposed, generally, usually by the legislators, but sometimes it comes from groups. And one of the major ones that I just can't go through all of them, don't have enough time. But one of the major ones was the a legislation that Ortiz had been proposing for years, but it just never had any energy. And this past year, well, when Assemblywoman Rojas came in, and she actually took over his district, and they resubmitted the legislation, which is to have a school social worker in every school district. So that was in the assembly, that's in the assembly. But alongside with that, Senator Jackson, he proposed the same legislation, but he said school social worker in every school. And so we were, yes, because we were asked to support Rojas's legislation, which we plan to do, but we felt that just having a social worker in every district was limiting, and that how would that fit in with urban centers, that a school social worker in a district just would be fruitless. They couldn't do much of anything. It's too many young people. So when we heard that Senator Jackson he was supporting the legislation, but he said in every school, we said yes. So what we have done is we have actually, and I'm going to jump, but I'll have to come back to it. But for our Capital Action Day, when we met with them, they asked for letters of support from us, because we asked, how can we help? And they said, we need a letter from support from you, because we're having budget meetings. This was on a Tuesday. We're having budget meetings on Thursday. And we need to have your letter in our files. We need to have them in our billfold, whatever it is they carry to these meetings. They said, we need to have your letters there. And so they gave us an opportunity. And what we did was we actually combined the two legislations. And we said, we support both. We said we support Senator Jackson's legislation that says a school social worker in every school. But the other thing that he said that we thought needed to be there was he didn't just say a school social worker in every school. He said a full-time equivalent social worker, which meant that every school has to have at least a full-time social worker. We said, yes, that's what we want. But we also said with Rojas legislation, we have to recognize rural areas. Some rural areas have low student population. And so therefore they may not initially need a full-time school social worker in every school, but they could have in every district and then work up. So we're waiting, we will be monitoring that. We will be meeting with them again to see how it's going. And I just want to alert you to the fact that we may be sending out an Act Now campaign, whereby we will need you to be sending emails to various representatives, encouraging them to vote on this legislation. There is money set aside in the governor's office for this, but we are looking at what numbers will come out, because we want to we're asking for something at least 70 million and above to ensure that this is adequately funded when this legislation passes. And you hear me saying when, not if. And there are other legislation that is also occurring that we're interested in. But that is one of the main ones that we are watching. We feel the cesarean, legislation related to cesarean, women and cesarean choices, that probably will pass. It probably doesn't have any money tied to it. It's more about education. We also are, watching the less is more implementation legislation to ensure that it is adequately addressed. And we are doing other types of, watching pieces of legislation that we were not aware of, but they are now, in the agendas of various committees. And so we will be going through those, analyzing them, and then determining with the committees on which ones do we want to support at what level, because we do support various activities in various levels. One may be that we send a letter of support, and that's pretty much our involvement. Another one might be that we do letter support, but then, we may be asked to do an Act Now campaign to get, our members to support this legislation by sending emails or the Twitter, whatever. And by the way, Twitter is the favorite child for legislators. So usually now we're telling people use Twitter to communicate with your legislator. But to have, to have that level, or it might be that we may need to actually go to a legislator, make an appointment, go and have a discussion about the legislation and why we support it, and then go from there. So again, to be mindful of time, I do want to call your attention to that we did have Capital Action Day on February 15th of this year. And every year from, we're planning now that every year, second week in February, there will be a Capital Action Day. Initially, we were planning this to be in person, but we had to do it virtual. But hopefully next year, it will be in person. And by that time, we hope that we have engaged all of you to such an extent that you will be coming to Albany. I'd love to see, and I know Sam would love to see, like 200-300 social workers showing up at the Capitol on Capital Action Day, meeting with their representatives and talking about the legislative priorities of the chapter. This year we had, it was virtual, and what was, it was an awesome event. Really just a lot of work went into it. And I just want to say thank you to, the staff that was working with me. We call ourselves a team. That includes Tamara, Sarah, and Amanda. And, they were just tireless in making sure that all that was needed for Capital Action Day actually occurred. And our day included, initially starting out after greetings, to actually have the social workers who are legislators in both the Assembly and Senate say hello. And we had one senator, Ruark, and we had 4 Assembly people who came in and said hi. And, just talked about why they chose to go into policy and, run for office. And we wanted them to do that because we are encouraging more social workers to really consider running for office. We need more social workers in the legislature. And then we went into, actually looking at some of our priorities. And one of our priorities is called End to Predatory Court Fees. You can see what that is about on our website. But we had met with both the senator of the, I'm blocking now, of both committees related to where this sits, this legislation, because your legislation is comes out of committees. And so, when we're talking to a legislative person, we usually go to the chairs first to discuss with them what we're interested in, and then have them, follow through and guide us in what we need to do to help them get the legislation passed. Then we had Senator Robert Jackson and Assemblywoman Rojas, and both of them are chairs of the mental health committees. And it was in that one where we talked about the school social workers and ensuring that this legislation will be passed. Then we had a meeting with Senator Prasad from the Social Service Committee, and Assemblywoman Linda Rosenthal unfortunately couldn't be with us. She was coming. She was committed. She was confirmed, and she was coming, but she got called out into a meeting, on that day, and was just really apologizing. Really sorry she couldn't be there, but those things happen. What was interesting with Senator Prasad, and please, we have a clip of her talk on the website. And she talked about a recognition about social workers, perhaps, some, if not all, are not compensated at the level that they should be, according to the responsibilities that they have as a professional. And so she's interested in addressing that. Along with, she did talk about loan forgiveness. And we are actually now doing some analysis, because in the governor's proposal, there is something about the changes in TAP assistance. And there's some narrative around loan forgiveness for mental health professionals, but we don't really know yet what that really means. And we are waiting for the we do have all of the budgets. We have, by the way, there are 4 budgets. We have the governor's budget, we have the assembly's budget, we have the Senate's budget, and then we have the people's budget, which is a budget that has been developed by the Black, Puerto Rican, Hispanic, Asian caucus. And so they have come out with their budgets. So there are 4 budgets, and we're looking at all 4. And by the way, all 4, we have links whereby you can actually get to the actual budgets themselves. But we are in the process now. We've done an analysis. We actually are making charts to show the relationship between the various budgets. And that will be up on the website this week coming forward. And so, our intention also is, as we get information on whatever's happening that we think is important to you, we're putting it on the website. So continuing, and then we had in the afternoon, we talked about telehealth bills, and in the telehealth, and there are a number of bills under telehealth, and some of them are quite detailed. I mean, 90 to 100 pages. But one of the things right now that we are looking at is the issue of parity in terms of whether or not you provide a service either in your office or you provide it either in an organization or you're providing it virtually. And there is legislation around addressing parity so that the insurance companies do not accept, do not reimburse. Right now, they're not reimbursing perhaps sometimes on the same level. So parity is that they will not be able to make decisions on whether or not they're going to pay you one number if you are seeing someone in person versus if you're doing it virtually. And that's coming out of the Health Committee with Assemblyman Gottfried, and we were not able to meet with their legislative director, again, because they got pulled into a meeting, but we are setting up a meeting in the next 2 weeks to find out the status of that and what we need to do in terms of, as a chapter. So that is our Capital Action Day. And what we have done is we have actually, we have expanded the website. So the advocacy section of the website is quite detailed now. And we have all of our legislative priorities on there, as well as the legislation that informs our priorities. We also have definitely Capital Action Day. We have excerpts from the meetings that we had on Capital Action Day. There's also, if you want to just sit and observe the whole process, that you will be able to get that through a link that'll take you to YouTube, and you can watch it as if you were actually sitting in Capital Action Day. But we thought on the website itself that we just have clips of what occurred. Also on the website, we have training webinars, and these webinars, such as the members last year, asked us, well, can you do something to tell us what is the legislative process? So we have a webinar that takes you from January, when the state of the state message is relayed to all New Yorkers, from that point all the way until the legislative session ends in June. We talk about what is the process that happens. How does legislation get introduced? What do we mean? We say piece of legislation is in committee. What's going on? And then you have 2 trajectories in a sense going on simultaneously. You have the legislation world, just laws, but then you have the budget, the New York State budget, and in that trajectory you have what's called budget bills. And so sometimes they come together because some legislation requires money, so they have to coincide. Others, if legislation, is not pertinent to the budget process per se, depending, that may wait until after April 1st, and then the legislature will pay attention to that. So from our perspective, we need to understand that process, because we need to know where to put more emphasis. Because right now the emphasis is whatever needs to get passed by April 1, that's where we're putting our energy. And just to say that we're still working on this, because we are looking at what kind of money do we need to ensure that is going to be in the budget that, that will fund the various things that we feel are pertinent to the profession. Now, that may mean that it doesn't mean new things. It could be programs that people are already in. But that, again, everything is looked at, examined from this perspective of, okay, what are we going to pay for this year? I also want to bring up an important initiative that's happening. It's called the Veterans Mental Health Training Initiative, which the chapter was not funded, did not receive new funding in 2021, although there was, lobbying for that. However, this year there has been, well, it started the end of last year, but this year there's been a lot of strong lobbying related to it, a lot of meetings going on. And from that perspective, it appears that there is support from, bipartisan support on it. So we're hoping, but it appears that this initiative will be placed in the budget, and that's what we wanted. We wanted it to be in the budget as opposed to what we call a legislative item. And so it may happen. Just please, and again, if we need your help, we will be asking you through Act Now. So I could keep talking here, but so I just wanted to give you some highlights. Again, please go to the website. The website will take you through the whole process in the sense of, what were our initial priorities. We have tracking. We have a tracking mechanism that we're doing. So we're tracking legislation. So we know week by week where it is, and what may need to be done. So we have that, we have information on the legislators who are chairs of committees that would potentially are the committees for which pretty much, I'm going to say between 70 to at least 70% of legislation that will be pertinent, germane to us as social workers, that those are the committees that legislation will be in. And so we have, their names plus on the agenda, we have their names there, and we have, links so that you can go right to every representative and find out who they are, what district they're in, and how do you contact them. So we have that. We also have the toolkit, the advocacy toolkit, and you please visit that. It talks about just how a law is passed, how to contact your representatives, and the various means that you can contact your representative. And they even give you a little script on, how you can, present yourself. And we are encouraging members to at least have contact with your representative, hello, my name is, blah, 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 a little bit. And, so that then as we go forward, you will be developing these relationships with your elected officials. And let me just say that many of them do return your message. They do thank you and all that, is a very more transparent. That's the other thing I just want to bring up. This is more of a very transparent government. I'm just amazed. When I was doing this work many decades ago, we didn't have this, but all the budgets are on, every hearing, everything that the legislators are doing, they're putting it on the websites. So there's no hidden, there's still some negotiating stuff that they're not going to put on the website, but what I'm saying is that, the information and the movement is very visible. Also the hearings. So you can go on to the websites and there's a listing of the hearings and you can sit in, and since it's virtual, you can sit in and listen to the hearings. You can hear who's testifying. You can hear what their positions are. And, that gives us the information then to think about who are the people who are supporting what we support, but who are the people who are going to be our opponents? We got to know what the opposition is saying in addition to what the proponents are saying, because then we have to have, the necessary information and statistics to show that while we understand what the opponents are saying, sometimes they may not be correct. And so therefore, even if they are, they don't have all of the information, et cetera. So this is a process that keeps evolving over time. And as we keep doing this work, the chapter will have greater and greater level of sophistication around advocacy and lobbying, because we'll just keep doing it. You know, as you keep doing something, then your skills become stronger and more expanded. So we look forward to working with you. You know, please, at any time, if you have any questions about, you know, something that you've heard around a bill, or you're aware of some piece of legislation or some process that you feel is something that maybe needs legislative intervention, please do not hesitate to connect with us, and we can go forward. And by the way, as of June, the end of the Kazal cycle is June. So after June, we will be looking at people who want to remain on the subcommittees, but also we're open to other people who might be interested in coming and joining us in these subcommittees as well. We do want to keep the number low, we don't want too many, because then it gets into the managing of that becomes a little bit problematic. But you know, I'm sure there'll be enough space for people to connect with us and work with us in the future. So hopefully next year at the annual meeting, we'll be able to see each other face to face. But again, thank you for listening. And I look forward to connecting with all of you in the future. And please, as I indicated, if you see an announcement of Act Now, we need your help. We need your help. Okay, thank you. Have a great day. Goodbye.